What are safe blood pressure ranges after stroke? Managing blood pressure after a stroke is a delicate balance. It's crucial to keep blood pressure within safe limits to prevent another stroke while ensuring the brain gets enough blood flow. The exact numbers depend on how long it has been since the stroke and what type of stroke occurred. In the first 24 hours after an ischemic stroke, especially if the patient is receiving clot-busting treatments, blood pressure needs careful control. Before starting treatment, blood pressure should be below 185/110 millimeters of mercury. After treatment begins, the goal is to keep it below 180/105 to reduce the risk of bleeding in the brain. For patients who are not receiving thrombolytic therapy, doctors generally aim to keep blood pressure below 180/105. Lowering it too much too fast can reduce blood flow to the brain and cause more damage, so gentle, controlled management is key. Once the immediate danger has passed, the focus shifts to preventing future strokes. Long-term blood pressure targets are usually below 140/90. Some guidelines suggest aiming even lower, like below 130/80, especially for patients with small vessel disease or lacunar strokes. However, lowering blood pressure too much can also be risky, potentially causing dizziness or inadequate brain perfusion. Therefore, treatment should be tailored to each individual, considering their overall health and tolerance to medication. Normal blood pressure is less than 120/80. Blood pressure between 120 and 139 systolic or 80 and 89 diastolic is considered elevated or stage 1 hypertension. High blood pressure above 180/120 is a hypertensive emergency requiring urgent care. It's important to remember that both high and very low blood pressure can be harmful after a stroke. Too low blood pressure might mean the brain isn't getting enough blood, which can worsen outcomes. Common medications used to control blood pressure include thiazide diuretics, ACE inhibitors, and angiotensin receptor blockers. The choice of medication depends on the patient's other health issues and how well they tolerate the drugs. Starting or adjusting blood pressure medications within days after a stroke can significantly reduce the chance of another event. In summary, after a stroke, the goal is to keep blood pressure below 180/105 during the acute phase, especially if thrombolysis is used. Long-term, maintaining blood pressure below 140/90 helps prevent recurrence. For some patients, even lower targets may be appropriate, but this should always be discussed with a healthcare professional. Remember, individual needs vary, so personalized treatment and regular monitoring are essential for the best outcomes. Always consult your doctor for guidance tailored to your specific situation.